Hello, everybody. This is a little bit different of a podcast because I'm doing this solo. I don't have a guest today. This is Lisa Salberg. I'm the founder and CEO of the Hypertrophic Cardiomyopathy Association. And I'm here with you through podcast today just to give a recap of last weekend's events and to let you know where you can get additional information should you be so interested. So the actual International HCM Summit 8 was held in Boston last weekend. The summit was originated by Barry Marin as an opportunity every 3 or so years to get together with researchers in the field of HCM and share where we're going, where we've been, and what's happening in HCM. And this was the 8th summit. This one was co-chaired by Steve Amman and Marty Marin, and it was wonderful to see Barry Marin present and presenting and sharing his insights. So I just thought I would kind of go over some highlights from the summit. If you are a medical professional and you're interested in getting the entire content, I'm going to drop a link down here right now. That should go out to everybody. That is where you can get information on the summit, and the content is still available online for CME credits if you want to log in and use the platform. It was a great user-friendly platform, and some of the talks were just absolutely extraordinary. Um, the start of the summit was a great day. We did a lot of genetic talks on day one, kind of set up the conversation for the coming days. Then we went into some imaging talks. But I want to give a shout out to Jody Ingalls, who gave the Max Sains lecture, which I was super proud of her for doing, as I did know Max quite well at the end. And we're sorry he's no longer with us, but I want to acknowledge that his name talk was handled very well by Jody, and that was familial and non-familial inheritance of HCM. Is it always genetic? So we really spent some time diving in there, and no, we don't know all the genes yet for HCM, and there is a very significant problem within the community of the understanding of gene panel negative, meaning no mutation identified. This is a very confusing concept for patients. We hear the word negative, we hear no, we're done, we're out. That's not what negative means in genetic testing. It means no mutation identified. Please check back at a later date. So she did a really good job of explaining that. And Anjali Owens did a great job on who should get genetically tested. And the answer came back very clearly. Everybody should get genetic testing because all thick hearts are not all the same thing. And as we move into our next phase of an organization, being the community of the big hearted and for the big hearted, it's going to be more important that all these thick hearts get screened properly with genetics so we know what the proper therapeutic options are for that individual going forward. Michelle Michaels did a great talk on genotype positive, phenotype negative. When do you take action? Great talk, high level. Seema Mattel discussed the role of screening tools and measurement tools for pediatric HCM, which we're going to be doing a lot more work with going forward. It was a great talk. There was a good panel at the end of that. Dan Massara was in that original panel talking about prevalence, and we've seen numbers as low as 1 in 67. The 1 in 500 still holding true in a lot of studies, but data is all over the place. So is it 1 in 2, 250, 3, 300, 500? We're still trying to figure out in the real world what that number really is, but we're getting it closer down to, we can all agree that 1 in 500 is kind of like the top end, but it could be lower than that to 1 in 200. So we're living in the 1 in 250 range while we're figuring that out. So that was the first morning. Melinda Tsai and Harry Rakowski talked about some imaging modalities, cardiac MRI, what does ESV mean, and how can we use that measurement more appropriately. We talked a bit about strain later on in the day. So great content there, and really honing down what is the differential diagnosis of HCM versus other thick heart disorders, and how can we use imaging to determine that. There were some product theaters throughout the day. I'm not going to give you a blow-by-blow on the entire agenda, but there was some really interesting talks about newer technology for sudden cardiac arrest risk assessment. What are the current tools teach us, the ESC and the AHA tool? Where are there gaps? Where can we go forward with better understanding of what these risk factors mean and who should device up, and then which device? Regular transvenous ICD, the subcutaneous ICD, the newer EV-ICDs, like where are we going in the future? A lot of conversation about that. Obviously, we heard from Barry Marion on risk stratification. He's done some amazing work there. Then we got into differential diagnosis, Danon, amyloid, and Fabry's. And I could not be more happy to see these individual diseases addressed at the summit at this very high level. We need to know who's got the thick heart and why, so we can get them to the right therapies. So the summit is still available online, and I would encourage everybody who's interested from the professional point of view, whether you're industry or you're a clinician, please go take a look at the content. It's amazing. It was a great weekend. It was a good vibe. For those of you who've been to a lot of medical meetings, some of them are just kind of, okay, plug and play, let's go do the thing. The energy in this room was palpable. The excitement for future therapies was present. We talked about using AI technology to find the undiagnosed. We had an industry breakout session on that. I was on that panel, just kind of like, where can we go? Where do we find these people? And how can things like the Viz AI platform help us in that diagnostic process? Are there more things that we can do? Can we open up people's eyes with other technology advances? We've got a long way to go here. So we talked about AFib management. Ethan Rohn took that dive, went into that. And Ahmad Manzouri talked about non-obstructive HCM and what can we provide for that. Now we have new myosin inhibitor trials for the non-obstructed. You have myosin modulators coming into the topic. There's so many new options here. And of course, the biggest option of all is we talked a little bit about genetic therapy and where are we going with this new gene therapy. So much happening, so much science. And then we held our Saturday night at the summit with the HCMA. We had 170 people in attendance, a little bit bigger than I expected, but that's okay. Everybody was welcome. During that event, we did something very unique and very special, and there will be photos posted very shortly about it. When you're telling the story of HCM and you're trying to put all of the pieces of the puzzle together to give a good representation of the community and the challenges that some of us face, every story is amazing. And our clients are all just extraordinary people living normal lives with this disorder and trying to manage it. But the story we chose had some ties to Boston. And that is, we told the story of another Lisa from New Jersey who ended up with HCM and going to transplant. So she was treated by Marty Maron at first, and then as her disease progressed, she was referred to NYU. So it was Marty while in Morristown, and then referred over to NYU and their advanced heart failure program for transplant. And that's great. We love that partnership. And she waited at home for her heart in the summer of 22. And then something unthinkable happened up in Boston, in Massachusetts area. And a gentleman by the name of Michael Canada had an event. He ended up in the hospital at Leahy, another HCMA recognized center of excellence. And Michael was not going to survive, and his family allowed him to be an organ donor. At the annual meeting this year, we reunited the family of the donor with Lisa, the recipient, and they were there to help us explain to everybody that this whole thing takes a village. We need great clinicians. We need great hospital systems. We need great HCM programs to shepherd people through their HCM journey, no matter where it lands, up to and including transplant, which is only 5%, so don't worry, most of you won't ever get there. But when it all needs to work, the clinical trials need to be there to really give us a good basis of what we can do to help these people. And then the logistics of the business model of how all these programs work and coordinate has to work when it needs to work. If it doesn't work, the heart doesn't get to where it needs to be. So we told this extraordinary story of how Lisa got her transplant and how all of these medical professionals worked together to ensure that the donated organ was appropriately utilized. And it was a tearjerker moment. So I'll tell you a little side story as I am leaving the one panel and we're coming into the event, and I see Lisa standing by the entrance, and I see Michael's family standing in the back, and I immediately ran over to Michael's family to thank them for participating and to be, just really engaged in the evening. I wanted them to know what was going to happen, so I did a little run through with them. Unbeknownst to me, over my shoulder, there was a moment happening, and I turned and I saw Michael's grandmother put a stethoscope to Lisa's chest. Let me just tell you, nothing can prepare you to look over your shoulder and see that. And I might have gotten a tad bit emotional. I'm like, wait, I need a minute. This is a little bit much. But it was a beautiful reunion, and I'm super honored to have had his family present. I said, I don't know my donor family other than a letter. So I'm like, you're now my adopted donor family. I'll jump on with Lisa on her donor story, because it was just a beautiful moment to share. And not everybody gets that. So that was Saturday night at the summit, followed by Sunday morning, where we heard some international stories. And if you have not signed up for the summit and you did not see this live, this is the price of admission right here. A physician from Ukraine talked about doing myectomies in a war zone. If you want a real sobering experience as to what's actually going on in the world today and some of the adversity that some of our physicians are facing, not only our families, but the physicians that are serving them, he was up on the dais at 10:30 a.m. on Sunday. He was amazing. He had the audience just on the edge of their seat. The photos, the stories of he did 188 myectomies in the last 2 years in a war zone. Just absolutely heart-wrenching stories. And we all need to do more to bring that crisis to an end. We heard about China and the new approach that they're doing to myectomy, which sounds super interesting. And I hope to learn more about that. I'll be meeting with them again soon. We talked about Iceland and their long history with HCM. Then we took a trip to India, and Hisham Ahmad talked about how his program has been growing. And then we even heard from a gentleman from South Africa and their new HCM program. So HCM is permeating the world, and we're really excited to get our HCMA international programming kind of scaled up so that we can, in fact, serve the entire world of those with HCM through the hands of our advocates in their own countries that we hope to train up in the coming months and years. We talked at the end of the day about the hopes of gene therapy. There we are again. We started with genes, we end with genes. Isn't this all about genes? So super interesting information there. Eric Adler shared a story about how the Dannon's project is going, and some other projects in gene therapy and HCM are progressing. So it was really fascinating, but showing the proof that we need some education in this space. A gentleman was about to be consented into the Dannon's clinical trial. And Eric and his team went through 19 consent pages for the Dannon's trial. Now remember, Danon disease is like HCM on steroids. The young men progress very quickly and they go to transplant or death in their 20s typically, Women can have a different manifestation where they have a different form of heart failure that shows up a little bit later, but some can have the same appearance as the boys or the young men. So this man was consenting into the trial, and at the end, the last page, it was the vaccine page, all the vaccines you need to have this. And the gentleman didn't want to have a COVID vaccine because it was going to alter his DNA. So he thought, while he was consenting to a clinical trial, to actually purposely edit his DNA to get rid of the bad and add the good that we could stop a disease with. So we need people to come to a better understanding of science, technology, and how these therapies can be utilized. Marty and Steve ended the day, and then at the end of the day, we had a break, and then we flipped it to the HCMA annual meeting. And I will be posting a video of that in the coming weeks for most of the talks, so you'll be able to see that. I didn't want to go a Friday without talking to you because I didn't talk to you last Friday because I was up at the summit. We'll be back next week with a whole bunch of content, and I wanted to talk to you about that. So let me pull up my trusty dusty calendar here. So next Thursday, we will be having a lunch and learn with our friends at Viz.ai discussing the integration of AI technology to identify the undiagnosed. So we're going to be talking about how this technology could be implemented and how we can make sure more people can get access to early diagnosis. So I encourage you to join us there. That'll be noon. It'll be a lunch and learn. So I encourage you to sign up or just come on and join us in for that one. And then at 3 o'clock in the afternoon next Thursday, I will be joined by our intake coordinators, Linda Montgomery and Sabrina Cuddy, as well as Noreen Dolan, our navigator, who will be explaining the intake and navigation process to all of our listeners and encouraging those who have not already done so to get involved and come do an intake and do a navigation call and learn what we're all about. And then on Friday at 11 o'clock, I will be joined by Dr. Marty Marin for Tales from the Heart, where I am going to ask him a little bit more about his thoughts from the summit and where we're going there. And then at an hour or so later, I think we're going to start at 1 o'clock or 1:45 after 12:45. No, we're going to start at 1 o'clock. Sorry. Dr. Harry Lever and David Light, he's a pharma guy, PharmD guy. We're going to talk about the quality of generic drugs in the United States. David Light has just earned himself whistleblower status for some of the work that he's done on uncovering problems with generic drugs. And we're going to have a very in-depth conversation. There will be slides on this one. So it's listed as a podcast, but it's really a podcast because you're going to have content on the screen. So I encourage you all to join us next Friday at about 1 o'clock. On the Facebook page and YouTube and LinkedIn for this very informative and a little enraging conversation about the quality of generic drugs in the world. There are good ones. There are definitely good ones, and we want to make sure you know how to know the good ones from the bad ones, but we need to be doing more to make sure that we're not getting bad drugs distributed through this country through lots of different problems that could happen, including the drug quality itself, the dissolution rate, how long does that extended release mechanism work? And last week, not really on topic for this conversation or this webinar, but last week or the week before, the federal government commandeered a number of online pharmacy websites because they were actually distributing drugs with fentanyl in them. So drug quality is a major issue that we all need to be aware of and make sure that we can keep people safe. So hello from Bangladesh. Thank you for joining us. So that's pretty much what I wanted to talk to you about today. It was a great weekend last weekend. Want to tell you something else. First weekend of December, we are going to be out in San Francisco, in actually South San Francisco, and we are borrowing the lobby of our friends at Cytokinetics to have a regional meet and greet and a little education session on HCM and what's coming up in HCM. So we'll be opening that registration hopefully on Monday. I know it's a little bit late, but we were a little bit busy this fall. And for those of you in the Chicago area attending the American Heart Association conference, HCMA will be there. So if you're from industry, please stop by and tell us, hey, I listened to Tales from the Heart. And maybe I'll have a little prize for you if you tell me you listened to the podcast. All right, ladies and gentlemen, that is all I have to say on this Friday. It's been a crazy 2 weeks. Thank you to everybody who made the summit amazing. Emily Malone, we bow to the goddess of meetings, and your whole team did an amazing job. Steve, Marty, Barry, Ethan, great job from the team at Leahy and Mayo. So thank you very much for all of that. So much good stuff coming, people. Stay in touch. Stay connected because I got a whole bunch of new stuff coming your way real soon. Take care, be well, and take care of those big hearts.